What if your house was making you sick? Across the world, poor housing is at the root of a wide range of illnesses. Walls and roofs can host insects that transmit infectious diseases. Lack of ventilation can increase risk of many airborne diseases, such as tuberculosis, and compound the effects of dusts and pollutants, such as those from indoor stoves using solid fuels. Direct contact with wastewater or indirect contact through contaminated water supplies is a common source of diseases from bacteria and parasites. Windows, doors, and eaves can be entry points for vector-borne diseases such as malaria and dengue fever. Bed nets often tear or go unused. Dirt floors carry parasites, bacteria, and viruses that cause diarrhea, hepatitis, typhoid fever, and neglected tropical diseases like trachoma. Overcrowding is also a major driver in the spread of infectious diseases and is linked to higher rates of sickness and death. 1.6 billion people live in these kinds of conditions. That's over 20% of the world's population. But that's not the end of the story. What if we told you that small improvements to housing could directly impact the global health crisis? Here are some fundamentals that can make that happen. Walls and roofs should be made of durable, stable materials that don't become insect and pest habitats. Homes should have sufficient ventilation. Waste should be dealt with appropriately, and water should be sourced from deep wells and be treated and stored safely. Windows and doors should have screens to prevent insects from entering, and the eaves, the space between roof and walls, should either be sealed or screened as well. Dirt floors should be covered with materials like cement. Why is this approach so important to us? Because now more than ever, we need a preventative health model. Healthcare systems across the world are overburdened and access is often limited. Drugs and insecticides are facing increased resistance. Research and development costs are unsustainable, particularly in the face of increasingly transforming diseases. Healthcare costs are rising in both developing and developed countries alike. There's more. The world is changing fast. By 2030, the world's urban population is expected to hit 5 billion. Around 1/3 of the urban population in developing countries, that's nearly 1 billion people, lives in slums. Global statistics show increasing losses from natural disasters. The quality of housing can mean life or death in the face of such events. Rates of homelessness are steadily increasing. The health problems created by this paradigm are numerous, with high exposure to diseases of poverty, violent crime, natural elements, and vector-borne illness. If you think this is only a problem in the developing world, think again. Across developed countries, poor living conditions are increasingly linked to poor cognitive development, mental health issues, and chronic diseases like asthma, which is currently the leading cause of ER visits in the United States. So join us. We're a nonprofit organization working around the world through housing design, public awareness, and advocacy. Small housing improvements make a big difference. That's Architecture for Health.